Welcome back. So now epinephrine. So in about the epinephrine, there are some people that they're not here yet. Okay. So if we are concerned about the epinephrine, like in cardiovascular patients, what we should do? We should always monitor the blood pressure and heart rate preoperatively. That's why if your patient has the history of hypertension or cardiovascular disease, you are obligated to take their blood pressure every time they come to you, okay, in the beginning of the session. We need to minimize the epinephrine administration, okay? As I told you, it should be minimized and less than 4 milligram. Monitor the blood pressure and heart rate. When you do the injection, is getting numb. Try to measure the blood pressure, heart rate again. Okay. You may re-administer epinephrine if blood pressure and heart rate is stable. So if patient doesn't have any problem, you're allowed to go ahead with another round of injection if it's needed. Okay, and then continue to monitor the situation. Another thing is that never use 1 to 50K epinephrine. Okay, never use it. Zero. It's zero. You cannot use it. Never use epinephrine impregnated retraction cord. Consider the limit of 0.04 milligram. And limit for normal healthy adults, 0.2, cardiovascular patient, 0.04 milligram. Treatment modifications to consider if there are concerns regarding the vasoconstriction. As I told you, consider limiting the epinephrine to 0.04 milligram and levonorepinephrine to 0.2 milligram. For healthy patients, we said the epinephrine is 0.2 milligram and levonorepinephrine is 1 milligram for healthy patients. Okay. Avoid epinephrine 1 to 50K. As I said, never use it for cardiovascular patients and never use epinephrine impregnated retraction cords. Okay. Retraction cords or raw cord, you see that they are epinephrine impregnated. Even now, guys, just for your information, even for healthy patients, they are not really recommended. Okay, do whatever you want to achieve with aluminum sulfide impregnated cords. Why you should use the epinephrine? Okay, and the epinephrine absorption for retraction cords, subgingival retraction cords, are exactly same as the absorption of the IV epinephrine. Okay, so it's too much for the epinephrine actually. Concentration retraction cord is 0.5 milligram per inch. Okay, not a bad idea to know it. Do not use hemodent, use buffered aluminum. If we don't use it, we can use the aluminum chloride, and they work actually very well. Okay, aluminum chloride pregnated cords, they work very well. Now, absolute contraindications for guys, apparently there is a problem in the internet connection. Is it good now? Is it good? Yeah. The cord, all I said, the cord is the concentration is 0.5 milligram per inch. It's not a bad idea to know the concentration. However, we should know that it's better to not to use it, and instead we can use the aluminum chloride pregnated cords instead. So the absolute contraindications for vasoconstrictions, okay, it's that the true allergy to metabisulfites, again, bisulfites, not the, okay, and because they are antioxidants for the vasoconstrictors. If vasoconstrictor is there, these are also there, so we are not allowed to use them. It is antioxidant for both epinephrine and levonorepinephrine. The patient has taken cocaine or any amphetamines in last 24 hours. Okay. Only for levonorepinephrine, patients would take 3 cyclic antidepressants. These are absolute contraindications. Okay. It means that you are not allowed at all to use epinephrine and levonorepinephrine in these patients. So guys, remember that patients who are allergic to sulfonamide drugs, okay, which we call them sulfa drugs, okay, they don't have any cross allergenicity with this sulfite, okay, totally different category. So we don't need to be worried about using the vasoconstrictors in those patients. Indications to minimize the dosage of the epinephrine. First, hyperthyroidism. 2, hypertension. 3, significant cardiovascular disease like MI, angina, stroke, cardiac dysrhythmia, CHF. Patient taking the following drugs: non-selective beta blockers, TCA, and COMT inhibitors. Any question? No? Note, epinephrine can be given to patients with MRO inhibitors like isocarboxide, phenelzine, peranilcypromine, and selegiline. Okay, so epinephrine is completely okay with those drugs. Now, calculation of number of cartilages in the presence of vasoconstrictors. Yep, of course. So ASA, it depends. If they are controlled, they are ASA2. If they are uncontrolled, they are ASA3 or 4. Depends on the severity of the situation. But anyways, doesn't really matter. It's ASA2 or 3 or 4, you are not allowed to use. You have to do the precautions. Yeah. It says if they are 3 or 4, no. Even if they are controlled, yes, we need to minimize. Yes, a stroke too. Like a stroke is also a vascular disease. Yeah, it happens in the neural tissue in the brain, but it's a vascular disease. The calculation of the number of the cartilages in the presence of vasoconstrictors. So the epinephrine that we have, the dosage are 1 to 50K, 1 to 100K, and 1 to 200K. And levonorepinephrine is 1 to 20K. So the calculation of the dosage. Okay, just guys, this slide is very, 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 very important. Okay. So the ratio concentrations represents grams per milliliter. Grams per milliliter. So when we have 1 to 100K epinephrine, okay, it means that we have 0.01 milligram per milliliter, okay, of the epinephrine per milliliter. Sorry? It's not in the note? Oh, really? Okay. So write it down. Write which one? Really? I can't remember that we had them. So did you write down the slide numbers? Yeah. Did you write the slide number? Okay, yeah, write it down. That's okay. We will send it to you. So 1 to 100K is 0.01 milligram per milliliter. Okay. And 1 to 200K is 0.005 milligram per milliliter. And 1 to 50K is 0.02 milligram per milliliter. And 1 to 20,000 or 20K is 0.05 milligram per milliliter. This is like how who asked about the calculation of the levonorepinephrine? This is how we calculate. Only for the liver. Yeah. Levonorepinephrine. So one cartilage, which means that 1.8 milliliter. So if you see, if you have 1 to 200K, it's going to be 9 microgram. If you have 1 to 100K, it's going to be 18 microgram or microgram. And 1 to 50K, it's going to be 36 microgram. Yeah, correct. You just need to do the multiple. Oh, you have it? Yeah. Okay. So is there any way that you reach to these numbers? There is, doctor, but I could never understand it because they were so complicated. And no one ever wanted us to reach to these numbers. So just the four number, just memorize them and get it done. Okay? Levonorepinephrine, the trade name is neocobephrine. 1.8 milligram cartilage of 1 to 20 K. It has 90 microgram. Okay, 90 microgram of the levonorepinephrine. Guys, for these numbers, I highly recommend you to just write them down all together in one place and try to just look into them on a regular daily basis and have them in your mind. Okay. I think you don't want to waste your time to just calculate to reach to these numbers, okay, in the exam, and then after that going to the calculation of the question. Okay, so it's better to memorize these numbers. Makes it much easier. Last slide, yes. Last slide, you have it in your notes, doctor. This one. Do you have this table? No? Okay. So this table is very important. So we're gonna just write it down. We're gonna send it to you, to the group. 112. So the ratio concentrations represents grams per milliliter. And this is 1 to 100K, 0.01 milligram per milliliter. Same thing, yeah. 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 You're writing it down? Okay. Done? Okay. So what is levonorepinephrine really? It's a synthetic vasoconstrictor. So we don't have it naturally in our body. Okay. It's more stable than the epinephrine. It's more alpha activity, 75% than 75% of the activity of the levonorepinephrine is on alpha receptors, and then 25% on beta receptors. It's weaker than the epinephrine, okay, but sometimes the reactions might be more severe, like what I told you in palate, what will happen in palate, okay? So the potency is less, but it doesn't mean that the reactions are less severe, okay? So 1,6 as potent as the epinephrine, eliminated by COMT and MO. If concerned, minimize the levonorepinephrine administration. Consider the limit of 0.2 milligram per appointment for cardiovascular patients. What is for healthy patients? Yeah, 1 milligram. Levonorepinephrine and norepinephrine are the same? Yes, kind of the same. 1 to 2 milligram. Only. Because MO inhibitors, they have less effects. MO is less effective than the COMT. Okay, so if you cause any problem for COMT, it will cause a lot of problem. But for MO, not really. It's not stronger. It's more active. Okay. No. Only on this. Only on this. Yeah. No. Next one. This one.
The one where you gave us information for the level.
This one. Yeah. Oh, you don't have anything about. So people are asking how many cartilage for levonorepinephrine you can give to cardiac patients. Okay, like that. There is nothing in the table. There is nothing in the table, anything there. But the calculation is easy. How much was the levonorepinephrine that we have in one carpule? One carpule. One carpule of one is 90 microgram, which is gonna be how much milligram? 0.09. Exactly. Okay. So you just need to see that how many you can give in order to reach to 0.2, which is 2 carpule. Am I correct? 0.09. So look, come here. Look at this. 90 microgram is 0.09. If you multiply 0.09 by 2, it's gonna be 0.18. Yeah. So it means that, and how much is that? It's 0.2. Okay. So only you are able to give 2 carpule of 1 to 2K of levonorepinephrine to cardiac patients. Okay. Did you get it? Are you sure?
I'm just a little bit confused with the ratio and the actual amount with the 90 micrograms.
See, they say that you need to keep the levonorepinephrine 0.2 milligram. Okay, 0.2 milligram per appointment for cardiac patients. Okay, and 1 carpule of levonorepinephrine, 1 carpule of methylphenidate 2% with 1 to 20K, levonorepinephrine has 0.09 milligram of the levonorepinephrine.
I just asked me about 0.09.
This one.
There, but
what's this?
I know it's there, but I know you're saying not that we don't need to know how to calculate it.
Yeah.
I need to know how.
Why? Oh, how is this number? I don't know. Same as you, I also do that. They have done the calculation for us at USD, but I really couldn't understand. No one understood it actually. I think even the profs who were doing it, they just put it on their slide. They didn't even do that. This is the calculation.
So that's telling us how much levonorepinephrine is in one cartridge.
One cartridge, yeah.
90 micrograms.
Yes.
So what we have to memorize is each cartridge.
You have 90 micrograms, yeah.
So what's the ratio at the top?
What do you mean by ratio?
Because for the one out of 50,000.
It's 1 to 20. Levonorepinephrine only has 1 to 20.
Right. So it was 1 to 20 and 1.05 and 50 micrograms, and then at the bottom it says 90 micrograms. That's what confused me. That's 4 ml.
Sorry?
50 was 4 ml, and for cartridge 1.8 ml.
Oh yeah, that's per milliliter. This is cartilage. Yeah. You don't need to know about the milliliter. Just know the cartilage. Okay. Don't memorize the milliliter. Just memorize the cartilage. No. Just go with the cartilage numbers. Okay. You don't need to. Yes. So all in all, for cardiovascular patients, maximum levonorepinephrine cartilage that you can give 1 to 20K is 2 cartilage. Okay.
For healthy, it would be like 11.
For healthy, it's gonna be for healthy, it's gonna be 1. So multiplied by 5, it's gonna be 10. Yeah. I think. Yeah. It's gonna be 10. Yeah. You're very welcome. So all in all, guys, I can't remember now. I got to remember that. I remember that they told us in UFD that 120K of the levonorepinephrine is same as 100K of the epinephrine. So whatever you have for 100K epinephrine, it's the same for 1 to 20K of the levonorepinephrine. Okay? Yeah. These numbers are important. You know them. So this table we already talked about it. Do you want me to go through it again? Just a quick review that for the epinephrine concentrations of the cartilage, for healthy patients, so 1 to 50K for healthy patients, 5.5. For cardiovascular patients, 0. This is not 1, it's 0. 1 to 100K for healthy patients, 11. For cardiovascular patients, 2. So you can just here write it down in this table in front of 1 to 100K that 1 to 20K of levonorepinephrine is also the same. Okay? And 1 to 200K is 20, 22 for healthy patients, and 4 for the cardiovascular patients. Yes, doctor, for everybody, levonorepinephrine 1 to 20K are the same as epinephrine 1 to 100K for everybody, healthy and cardiac patients, both. Okay. So how to calculate LA with the vasoconstrictors? So first we need to do the calculation of the local anesthesia. What are you looking for there? Mhm. Yes, but I don't know. They say that lectures and their books are completely each other. Anyway, so first for the calculation, if they ask you about the calculation of the cartilages with vasoconstrictors, what you should do, as I already mentioned to you, that first you go with the calculation of the LA drug, that you should be now mastering that. We've done so much practice on that. Okay, then you go with the calculation of the vasoconstrictors. Okay, and you don't need to do the calculation. You just need to know this table. That's it. Okay, and then come up with whichever number is less. Whichever number is less is your final answer. So for example, if the calculation for the LA is 10, but the calculation for the vasoconstrictors are 2, your answer is 2. Okay, so whichever is less. Okay, let's go to the first example. So calculating the maximum number of LA cartilages for this patient. What is the final answer? Yep, the final answer is 4. Yeah. So based on the LA drug, as you may pay attention, is that the 7 multiplied by 80 and then divided by 18 multiplied by 2, it's going to be 15.5, but the maximum for lidocaine is 13. Yeah. Okay, this is for the LA. LA, the maximum that what we can give is that. How about the vasoconstrictors? Okay, patient has the history of angina, so it's cardiovascular disease. So it's 4. 1 to 100K is 4 for cardiovascular. So the answer is final answer is 4. So I would say you can have a shortcut that if you see that your patient is cardiovascular patient, okay, don't go with the local anesthesia calculation. Just stick to what you have in the table of the vasoconstrictor and make it easier for you. Unless if they are pediatric patients. Pediatric patients might be less than this. Okay, yeah. So healthy patient, so see this is healthy patient. 80 kilogram, lidocaine 2%, epinephrine 1%. So same question, but the patient is healthy, not cardiac. So it's going to be 13. 13. Maximum is 22. Okay, so for the vasoconstriction, and the maximum for the LA is 13, so 13. Okay. Yeah, 13 is what we are looking for this question. Again, same patient, but this time is healthy, not cardiovascular. So for the LA drug, it's going to be 13 lidocaine at most. For the epinephrine 1 to 200K, it's going to be 22. Whichever is less is 13, so 13 would be the answer. Healthy patient, 80 kilogram, lidocaine 2%, this time 1 to 100K epinephrine. What would be the answer? Exactly. It's going to be 11. Why? Because this time 11 is less than 13. Okay? 11 is less than 13. the pits, it depends on the kilogram of the pits. Okay, now practice questions. How many milligram of 4 4% perilocaine with 1 to 200K can be given to 60 kilogram male with history of angina? So it's not about the number of the cartilages, so you cannot go exactly directly with the table, okay? So how many milligram of 4% perilocaine we can give to this patient with history of angina? So in this question, you don't even need to consider the history of angina. They are not asking about the they are asking about about the vasoconstriction. Yeah, you have to consider. So we know in this patient, a shortcut. We know in this patient, maximum is 4, yeah? According to vasoconstricted table, maximum is 4. How much perilocaine we have in one cartridge? 4 multiplied by 18? 72? Okay, so 72 multiplied by 4. How much is that? 72, you didn't get the question? Oh, the calculation, we need to do it, unfortunately. 28? 288, yes, 288 is the answer. Exactly, 2888. I'm sure if you go home and study it one more time, just again do the calculations that we've done in the class. That's also easy, you will get to know it. Can you repeat the calculation? Yeah. So guys, according to the perilocaine, with 120, and then according to the vasoconstrictor, we need to calculate how many cartilage of the perilocaine we can give to the patient, okay? But I told you, a shortcut for patients, okay, with a history of angina or history of any cardiovascular disease is to just consider the vasoconstrictor table. So according to vasoconstrictor table, for 1 to 200K, the max we can give is 72, is 4 cartilage, yeah? And how much perilocaine we have in one cartilage is 18 multiplied by 4. Okay, it's going to be 72. It's going to be 72. So 72 multiplied by 4 is going to be 288. 288. Now let's go to the second one. How many milligram epinephrine in 0.5% bupivacaine with 1 to 200K in one cartilage? So how many is that? How many? 9 microgram, 9 micro. Here is milligram. So it's going to be 0.009. It's going to be 0.009 milligram. It asks about milligram. What you say 9 is microgram. Okay? Be careful. Be careful. It's micro or milligram. Okay?
So the answer would be 0.09 milligram.
Is 0.009 milligram. Yeah. 0.009 milligram, which is 9 microgram. This is part of those numbers that they have. Yeah. Which one? This one? This one? Okay, let's go over there. What is this, doctors? What is the second? Okay. So now let's go to what you have there. So this is per milliliter. Okay. This is per milliliter. So what we have is 0.005 per milliliter. Correct? So what would be in 1.8 milliliter? It's gonna be 9. Point. Yeah. Am I correct or not? So for one carpule, it's 0.005 milligram per milliliter. So for 1 milliliter, okay? For 1.8, which is one carpule of the bupivacaine, is going to be 0.009 milligram. Did you get it? Because we have 1 yeah, yeah. Good. Okay. How many cartilages of 2% lidocaine with 1 to 100K can be safely given to 20 kilogram child with hyperthyroidism? Okay. So how many is that? According to the lidocaine calculation, it's going to be 7. Yeah, am I correct? Maximum recommended dosage multiplied by 20 is the kilogram of the child divided by 18 multiplied by 2, okay, which is going to be almost, I think, 3, yeah, 3 points, yes, 8 or 88. And so it's going to be 3. Okay, so the first number that we have is 3 according to the LA. And now, according to the hyperthyroidism, how much is that for 1 to 100K? Is 2. Okay, is 2. So the answer would be 2. Answer would be 2. This is imaginary case. It's it's severely rare to see a child with hyperthyroidism. It's very rare. But this is just yes, doctor. Yes, doctor. Hyperthyroidism is same as the cardiovascular disease. Which one, doctor? Doctor, second one, if you're asking about second one, it's not calculation, doctor. Second one, it's about the memorizing of the table that I showed you, which says in 1 to 200K, we have 0.005 milligram of epinephrine, okay, in 1 milliliter per milliliter, okay. Then in one carpule, which is 1.8 milliliter, sorry, yeah, milliliter, then it's gonna be 0.009. So it's about memorizing. You have to memorize those numbers. You have no choice. Even for the board exam, we have to memorize these numbers. They're gonna ask these questions. Okay. So I hope it's clear. Let's go to the topical anesthetics. So the concentration of a local anesthetic applied topically is typically greater than the same local anesthetic administered by injection. The higher concentration facilitates diffusion of the drug through the mucous membrane. Higher concentration also increases the risk of toxicity, both locally to the tissue and systematically. Okay. Application of the topical anesthetic. In Canada, we have to do it before the injection. Patients like it, although I believe that it doesn't have any effect. It's just a placebo effect. And yeah, so we can see that Oracux, a periodontal gel that contains 2.5% lidocaine and 2.5% perlocaine. I really recommend you to know these. Okay, they might come up with a new question about this. Okay, EMLA is etotic mixture of local anesthetics, 2.5% perlocaine, 2.5% lidocaine. Both are the same. And Oracux and EMLA are both same. They have same ingredients. This is the first slide of Capital. How many LA questions in the exam? Doctor, it depends. You can't really say that how many questions. I told you. In February 2019, they were, I think, more than 7 dental material questions. But in February 2020, that I took the exam, we had no dental material questions. So you cannot really tell them how much question you're gonna have from. It's completely based on chance. So Oraverse, again, as you can see, this is injection. Okay, very important topic is about the phentolamine mesylate. Okay, phentolamine mesylate. It's a local anesthetic reversal agent for adults and children. Okay, why is it important? Why phentolamine is very important? It's very important for pediatric patients and also for patients with special needs like disabled patients. In order to inject the phentolamine in the site of the injection right after the procedure is done, and it will completely remove the effect of the local anesthesia. So pediatric patients, they will not bite their lip, and disabled patients are not also harming themselves. Okay, it's a safe and effective for patients above 66 or above, and the patient should be also for sure more than 15 kilograms. Okay, anyone below 6 or lighter than 15, it's not really recommended to use the phentolamine. And what you should know about the phentolamine is that phentolamine is injectable, and you have to inject it in exactly the site of the LA injection. So if you have done the inferior alveolar nerve block, you have to do the phentolamine injection in the same place. Okay, so it should be in the same area. Which page is phentolamine? Do you have it? 216? Okay, 215, 216. So phentolamine mesylate is a non-selective alpha-adrenergic agonist. You should know about it. Non-selective alpha-adrenergic agonist. It blocks the effect of the vasoconstrictors in LA preparations, increase the redistribution of the LA away from the injection site, and it's approved as a systemic antihypertensive drug in 1953. Any question, guys? No question? So 1 milliliter of a 2% solution of lidocaine hydrochloride contains how many milligrams of the drug? Yeah, so it's easy, yeah? It's going to be 18 multiplied by 2, which is 36 for 1 carpule, which is 1.8 milliliter. Now for 1 milliliter, it's going to be 20. Yeah? So 20, B is the answer. Why?
Oh, because when I'm reading it and trying to figure it out, then you say it, and it's like, oh.
Yeah, don't worry. Everyone is like that in the beginning, and then it will be solved. So what is the maximum number of cartilages of a 2% local anesthetic solution that can be administered without exceeding a total dose of 300 milligrams? So how many milligram we have in one cartilage of the 2%? Yeah, of the 2% anesthetic solution, 36. So 300 divided by 36 is going to be 8.3, so it's going to be 8. So D is the answer. Yeah? Yeah, and the rest of the questions are for your another thing. Okay, so it brings us to the first session of the local anesthesia. Any question? I think the most important topic that you have in this session is the calculation. Okay, yeah, calculation, and also about the beginning of the lecture about the local anesthetic agents. Okay, the pharmacology. Yeah. Other than that, that would be the rest is easy. Even these are easy, just needs a practice. Okay, so please go back to last slide. Which slide, Doctor? This one? You want to write it down?
Yeah.
Okay, write it down. Yeah. Doctor, ORACU's concentration, I said, I think you have it even in your notes. No, you don't have it? ORACU's is 2.5% lidocaine, 2.5% peridocaine. Okay, yeah. ORACU's concentration is 2.5% lidocaine, 2.5% peridocaine. I will put a slide for that one as well. No, amylin. For which one? Yeah, this one? Yeah, they are the same. What is the relationship between ORACUX and Emlan? No relationship. They are two different brands. How to calculate if they use different LA during the procedure? I mean, they change to lidocaine from mepilocaine in the same procedure. How to calculate? I don't get the question right here. I don't get the question, and I really recommend you to make it for you complicated because they're not going to ask these questions. They want to assess your knowledge letter. They don't want to trick you. No, believe me. Okay. Any question? Yeah, of course. This one? Okay. So for online people who wants to log off, that's the end of the session for today. I'm going to see you next week for the second part of the local anesthesia. So wish you a good rest of weekend. And please practice on the calculation and let me know if you need any other help next session. Okay? Yeah. Have a good one, everybody, and enjoy your weekend.